this this conversation is centered around some work that you guys did around domestic abuse, particularly as a result of the COVID-19 pandemic. So my question to you guys is, how did you know that there was a problem in your area around domestic abuse?
Thanks, Graham. Yeah, I think it's a good question. And thinking back, I guess a moment of clarity came fairly early on in the pandemic when we were trying to work out as a partnership how we responded to the new challenges and what those challenges might be. And one of the we have a group who meet together, a design team of people who have a good kind of cross representation from across the area. And one of the elected officials, Councillor Jenkins, says, "Do you know what I'm seeing? I'm seeing more domestic abuse, more coming to me." And I just literally finished a clinic that morning and said, "That's interesting. I've seen 2 people this morning with that in some really difficult circumstances where, for example, a long distance lorry driver had not been able to work for a couple of weeks, had an alcohol problem, and I think issues had arisen in the house as a result of those increased pressures. And it spurred us to find out more and to understand a little bit more about whether this was something particular to us or an issue with the pandemic. And certainly by then looking for some data, we understood that Boggart Hill, an area within Seacroft, has the 4th highest rates of domestic abuse across the city. Police were reporting a call every 30 seconds about domestic violence during the first 7 weeks in lockdown. So it was not just a local issue, it was a national issue, and certainly something we all felt a real strong need to see what we could do collectively to address.
You were basically seeing people and those connections with the people, and Chris mentioned the strong community. You were actually seeing the evidence in your particular surgery that this was becoming an increased challenge as a result of the pandemic.
Absolutely. As I said, it took a conversation between us for us a couple of us to think, well, actually, hang on a minute, this might be there. Someone raised it and then thought it might be there. And one of the other interesting things is talking to other members of that group in that conversation. They initially felt that domestic abuse, they tended to work with an older adult population, and they felt that perhaps domestic abuse wasn't something that they typically saw much of. But as the pandemic grew, we also became aware of the increased issues and care strain that was apparent within home environments because of the confined nature of people's homes, but also lack of access to day services, other services that people typically had. So there's a real interesting evolution of what statutory organisations felt their experience of domestic abuse was and what was happening. And I think one of the outcomes that we had was that there was an increase in understanding and education around staff in terms of the different ways in which domestic abuse occurs and different types of abuse.
Thank you. So, and I just wanted to bring Amanda in. So from your perspective around, I suppose, children and young people, were you starting to see anything as well?
Yeah, what we were seeing was quite a lot more, an increase in domestic violence notifications from the police coming through to us. We were also doing a lot of the welfare checks at the time for the schools. So we were doing them door knockings to check on families. So families were having conversations. So we just saw the pressures. I came into the local care partnership group later on. So being invited as another partner to come in and support, really, because what we were seeing as well was the impact it was having on children and young people. So we wanted to ensure we knew what they were feeling and how it impacted on their lives as well. But we were definitely seeing that increase.
Okay. So what did you do? So I'm getting the sense that there's different people and different organisations are hearing the same theme. How did you come together and what did you do? And I suppose that's a question for anyone.
I'm happy to take again. So I guess we acknowledged there was a significant need to respond, and I guess in a certain way, in quite a timely way, really. Sometimes it can take a long time to mobilise change, and I think there was a lot of change obviously happening. Other things, we broadly split the plan into kind of 4 parts. So something around training and education, as I discussed before. I think certain areas of the statutory bodies felt this wasn't something that they were likely to see, but we kind of thought perhaps that wasn't the case, and so some education there was important. Definitely, as everything we're trying to do as a partnership, was around community engagement, understanding more about the perspectives of people and how we could work together. We wanted to work as a group of partnership, so make sure that we were bringing all partners in who were likely or to be able to support this, and then developed a kind of a bit of a, I guess, a communication strategy through social media, because we felt that was the greatest opportunity to spread information as fast and as broadly as we could. Yeah. So I think whilst it was the early pandemic, by this point we were reaching the white ribbon. I'm trying to think of it, the annual campaign that we're having each November to help draw focus around the issues of domestic abuse, and we felt that by utilising that as a point at which we could focus towards, and we decided to do that. So certainly around that Taking Action Day, we focused it around from there, and then off things went.
Okay, and so how did you use the Seacroft Local Care Partnership to, I don't know, corral everybody around this particular issue? Did you just come to a meeting and go, hey, we've noticed a challenge here, and then somebody else in the room said, yes, we've got a challenge too? How did the partnership working in Seacroft enable this, this 4-part plan to get off the ground?
I think everybody was seeing a very similar pattern. So from that, it was enabled us to say what we were actually seeing and what could we do about it. So it was then brought people in to say, what else can we add to the plan to be able to support the families, children, young people in Seacroft, Manston. So as George said, he went round the White Ribbon campaign, but we did a lot of training with staff, school staff and other agencies at the time, and we were also looking at which other partnerships we could build on to be able to support the work moving forward.
Yeah, I think, Graham, just to give you a bit of a concrete example. So I suppose as Amanda and George mentioned, bringing all those different organisations together was really powerful. And on one particular piece of work where we decided that it would be good to create some materials that would be used not only in schools but across the community settings as well, with parents and with some of the young people that we're working with. And I suppose what I found really fascinating was working with experts in DV and trying to put something together which we felt would be appropriate and engaging for our target audience. So we looked at the idea specifically around sort of toxic masculinity in the area, which we'd seen and heard about and seen as a visual problem in the area as well. I remember one of the people that we work with once describing some of the behaviours on a specific street and saying, the problem is with this, it's been normalised on my street. People just see it as normal now. And I think in response to that, we worked with a theatre and filmmaking organisation, and we tried to represent in a way, I suppose, some of those negative relationships that were happening, and again working with people who are really experts in this, and listening to some of the specific language around that's used in terms of like love bombing and lots of things that were new to me, was really fascinating. And then we were able to work with professionals to pull together something which we felt was quite powerful, but then bring it back to the group and tweak it and change it. So it really did appeal to, it was a place-based, if you like, response to this, so you could see how people might react to it in the area. And then we had that ability to be able to show professionals that we're working with, but also to be able to go and work with smaller groups and youth groups in the community and get their feedback from youth workers, from teachers, from young people about what kind of impact it might have. And we're still in the process actually of now launching that with the next round, with next White Ribbon campaign, and seeing how that goes.